Yes, yes.
Yeah. Sorry for the interruption. We can know there are hard signs and soft signs in glaucoma. This is known as the hard signs like disc hemorrhage, RNFL defect, notching, and NRR thinning are the hard signs. Now, straight coming to the disc damage likelihood scale, which is one of the scales which we measure the severities of glaucoma. It is calculated by the radial width of the neuroretinal rim measured with the thinnest point, and there are 10 different staging. This staging system is not very much accepted, but to give you an example, you can see the parameters like 0.13, it comes under DLS stage 5, stage 6, or stage 7. Now coming to the methods based on number and depth of defective points. The Mohoda Paris Anderson classification, which is one of the most widely accepted, and Mills et al. Staging system we'll discuss today. There are many other scoring systems. Though according to Hoda Paris Anderson classification, there are glaucoma can be divided into early, moderate, and severe. So early is less than 6 decibel, moderate is 6 to 12 decibel, severe is more than 12. But we must know there are other three parameters are also included in Hoda Paris Anderson classification. There is not only it is not mean deviation that is considered in the Hoda Paris Anderson classification. So give an example, you can see in that image, the mean deviation is minus 3.75, and the points that are like 18 points are depressed below 5% level. So it comes under, early. Now coming to this is a moderate. You can see the mean deviation. If you count the number of points, it comes under moderate. And this is a visual field which is severe glaucoma. So according to the Hoda Paris Anderson classification, these visual fields are classified into early, moderate, severe. Now coming to the Mills et al. Staging system, the severe form of what is in Hoda Paris Anderson is further subclassified like advanced glaucoma, severe glaucoma, and end stage glaucoma in the Mills et al. Staging, depending on the all other parameters, including the mean deviation. The mean deviation like minus 12 to 20 is advanced, more than 20 or worse, severe, and at the end stage glaucoma. And there is also stage 0, which is known as ocular hypertension or earliest glaucoma. So in this field, there is no visual field defect. So it comes under ocular stage 0, and early glaucoma is similar to the Hoda Paris Anderson, and moderate glaucoma also according to the Hoda Paris Anderson. But the other points are need to be considered into the advanced glaucoma. As you can see, this is a moderate glaucoma, and now comes to advanced glaucoma. The visual field, you can see that mean deviation minus 15.37. And the other points, according to the Hoda Paris Anderson, it will come under severe glaucoma, but according to Mills staging, it will come under advanced glaucoma. And this visual field, which is mean deviation of minus 28, comes under severe glaucoma according to Mills staging, but according to Hoda Paris Anderson, it still comes under severe glaucoma. And the end stage glaucoma, there will be no visual field in the worst eye, no visual field attributable to the central scrotum. Now coming to the one of the latest classification known as glaucoma staging system 2, which considers both mean deviation and CPSD and PSD. So to give you an example, this is the glaucoma staging system 2 chart. To simplify it, I'll discuss with some examples. You consider the visual field, the mean deviation is minus 1.43 and PSD pattern standard deviation is 6.08. If you mark that point, it will come under S2, which is a moderate defect. And in this image, visual field, we see the mean deviation is minus 9.52 and pattern standard deviation is 11.09. If you just look at that point, it comes under S3 zone, which is a localized defect. And you can see this advanced glaucoma, which is mean deviation minus 15.37 and PSD of 16.04, which comes under S4, so which is a very advanced and absolute defect. So this is a S5 and subterminal defect. So why GSS2 is advantageous? It is very quick, reliable, and it is standardized and faster and easier. What is the disadvantage? Disadvantage, it does not portray any sort of spatial information. So now coming to the classification based on the Babby's curve. So it is on the octopus, you see there is a standard deviation line. If that point comes below it, 95%, so it shows it has advanced glaucoma, which is classified into diffuse loss, localized defect, or mixed defect. There is a RPC study which classified different scotomas like paracentral, nasal, sedils, single arcuate, and altitudinal scotoma. And this is the picture which study done by Professor Ramanji Siota and ma'am. And there is one system known as Psi visual grading system, which is a systemic classification of Humphrey visual field, easy interpretation and evaluation, which shows different types of scotomas that we know. This is a normal visual field, no defect anywhere on the field. And this is a central scotoma, which is a defect within the center 5 degree, which is central scotoma. And this is a paracentral scotoma, the defects within the paracentral region. You can see that image on the visual field. If such type of visual field defects, you can see this is a paracentral scotoma. This is a paracentral crescent, the defects in the pericentral region that do cross the midline. You can see the paracentral scotoma does not cross the midline, and paracentral crescent crosses the midline. There is a temporal quadrant, the temporal wedge, which is very rare to find. We can any defect in the temporal zone is a temporal quadrant, temporal crescent. Nasal quadrant, you can see this defect, but I didn't find any visual field. There is a peripheral arcuate, which is a combination of defect that must cross the midline and does not include central 2 points, which is known as peripheral arcuate. So these are different types of scotomas that defined by Psi system. This is expansive arcuate, which has included adjoining defects in central region and paracentral region and temporal nasal quadrant. This is expansive arcuate. And you see the altitudinal defect. What is the difference between altitudinal defect and expansive arcuate? In the altitudinal defect, all the points above or below horizontal midline have a defect less than 0.5%. So after knowing the visual field and severity of glaucoma, what is more important is to know how to analyze the visual field progression. Why it is more important? Because according to the, if patient might come visit to our OPD with IOP of 10 or 12, but 20 diurnal variation, diurnal pressure might not be controlled. So visual field progression analysis will show whether the patient has controlled IOP or not. So it can be done by clinical judgment, trend analysis, or event analysis. So trend analysis is uses a linear regression for prediction of progresses. The minimum 2 to 3 baseline and 5 evaluation visual field required for the adequate sensitivity. Event analysis, these are already installed pair t-test programs in the Octopus like Delta program or GCP in the HFA. This is one of the examples where the visual field progression shows baseline field, visual field index over time, and 5-year extrapolation, whether that how that last 5 visual field shows the next 5 years the patient visual field is going to deteriorate or remain stable. It shows that the rate of progression is, as you can see here, minus 1.5 plus or minus 0.7% per year, and event based change. So that is why it is very important to know the visual field progression in all the patients and to classify how severe the glaucoma, because if it is severe glaucoma, our target IOP will be like 10 and 12. If it is a moderate glaucoma, our target will be 12 to 14. Hello?
Yeah, you need to wrap up.
Yeah, I finished only. I'm just saying we need to know the different type of glaucomas, like early or moderate or severe glaucoma, because the target IOP varies. So if my patient have advanced glaucoma and we are not following up with visual field and keeping a target pressure of 12 to 14, that patient is going to deteriorate further. So visual field progression and visual field is the only thing that need to continuous follow up in patients with advanced glaucoma or any glaucoma. And these are my teachers or mentors in the glaucoma. So my Professor Amanjit ma'am and Professor Tanuj sir and Professor Vinay Gupta sir. Thank you.